Let's continue our discussion on face reading, fatty liver. Fatty liver is caused by excessive buildup of fat in the liver cells. The fat content in a normal liver accounts for 3 to 5% of the liver. When the fat in the liver accounts for more than 5%, the liver is considered a fatty liver. Fatty liver is characterized by mild to moderate liver dysfunction and hyperlipidemia. In mild cases, there are almost no symptoms or only stiffness and distension on the liver area. In severe cases, however, patients will experience major symptoms such as pain, fatigue, indigestion, and swelling of the liver. Fatty liver can be a result of obesity, diabetes, drug poisoning, alcohol intoxication, viral hepatitis, and malnutrition. In face reading, the middle section of the bridge of the nose is the liver zone. If there are scattered yellow spots there, it may be indicative of a fatty liver. If the liver zone of the face is dark in color or has skin spots, you should attend to fatty liver as seen in the illustration below. Therapeutic methods. We must set regular meal times and consume regular amounts of food. Do not overeat at dinner to control calorie intake. Eat whole grains, vegetables, fruits, and soybean products. Control alcohol intake because alcohol abuse can seriously damage the liver and reduce its metabolic capacity. Massage. Massage the Yang Ling Kwan or GB34. This is the main point for the treatment of fatty liver. Use your thumb to press, knead the Yang Ling Kwan point 30 to 50 times once a day until this tension is generated. Long-term massage treatment works very well to alleviate the symptoms of fatty liver. Thank you for your attention.
Interviewing the amount of menstrual bleeding. The loss of blood during menstruation can vary between 30 and 80 ml. A period is defined as heavy if the loss of blood is either profuse or prolonged. It is important to ask how many days the period lasts because a period that lasts more than 5 days is normally considered excessive in Chinese medicine, while one that lasts less than 4 days is normally considered scanty. Although most women would describe as abnormal a period that either lasts too long or is too heavy, they would not use the same term for a period that is too short or too scanty. In other words, many women would say their period is normal when it lasts 3 days or even less, or when the bleeding is very light. A heavy loss of blood is due to Qi deficiency, blood heat, blood empty heat, liver and kidney yin deficiency, or blood stasis. If the period is scanty, it denotes blood deficiency, cold in the uterus, or liver blood stasis. Now let's go to the symptoms and patterns of heavy periods. Heavy menstrual bleeding that may come early with the mood pale blood, tongue is pale, pattern is Qi deficiency. Heavy menstrual bleeding, pale blood, irregular periods, backache, feeling cold, loose stools, tongue is pale and wet, pattern, spleen and kidney yang deficiency. Heavy menstrual bleeding, trickling after the proper time, irregular periods, infertility, dizziness, tinnitus, night sweating, tongue is without coating, pattern, liver and kidney yin deficiency. Heavy menstrual bleeding, bright red or dark red blood, feeling of heat, mental restlessness, red face, thirst, tongue red with coating, pattern, blood heat. Heavy menstrual bleeding, headaches, dizziness, tinnitus, irritability, tongue is red with redder sides, yellow coating. Pattern, liver fire. Heavy menstrual bleeding, irregular periods, trickling after the proper time, infertility, dizziness, tinnitus, night sweating, feeling of heat in the evening, 5-palm heat, tongue is red without coating, pattern, liver and kidney yin deficiency with blood empty heat. Heavy menstrual bleeding, painful periods with dark blood and dark clots, periods that start and stop, tongue, purple sides, pattern, blood stasis. So to summarize, heavy menstrual bleeding is Qi deficiency, blood heat, blood empty heat, liver and kidney yin deficiency, liver blood stasis. Scanty patterns are blood deficiency, cold in the uterus, and liver blood stasis. Thank you for your attention.
Let us discuss the Han Taiyin Lung Meridian, Tianfu, or the heavenly place. In this illustration, we will find how to locate lung 3 or the Tianfu. On the anterior lateral aspect of the arm, just lateral to the border of the biceps brachii muscle, 3 be chun inferior to the anterior axillary fold. This is called the window of the sky. The journey of the chi through the lung meridian started with the middle palace, passed through cloud gate, and now arrives at heavenly palace. This is a powerful point for the mind and spirit, being a window of the sky on the lung meridian. It has an enlightening and enlivening effect on the senses and spirit. Feeling shut in, closed off, and foggy mental processing of originating from an imbalance in the lung official can be helped with this point. It enables the person to feel cleansed, stimulates and brightens the sense organs, and helps the person let go of fears and negativity. A window of the sky allows free communication between the spirit of a person and the chi of heaven. This is especially needed when a person feels shut inside herself, unable to participate in life and relationships. When the receiver of chi feels itself to be disconnected from its source, from heavenly chi, nothing feels precious in life. Everything becomes debased, tarnished, or valueless. The heavenly quality of this point associates it with inspiration, cleanliness, purity, and revitalization, making it possible to see things in a new light and with a vitality appropriate to the lung when healthy. The lung has to balance the tension between the abundance and severity, as autumn does between harvest and withdrawal. Autumn is the time of punishment of criminals and crops, of setting off limits. When lung is in its distress, it can be severely self-punishing as well as forgetful of the protective canopy it affords the other officials. Heavenly Palace, with its heavenly refreshing attributes, can restore peace and the clear chi so essential to the lung. The name of the point, Heavenly Palace, indicates that these heavenly qualities are present in abundance. It is a place or storehouse, a place of plenty, a reminder that the official needs and receives nourishment from the earth as well as from heaven. The spirit of a person can be nourished and strengthened with this point. This point can inspire and elevate the spirit and reconnect the person with a richer quality of life. Tianfu is frequently used with Li 18, support and rush out, or Li 17, the heavenly vessel. It can also be used for its enriching effect with lung 1, middle palace, or with lung 7, the narrow defile, when there is need for release and refreshment of spirit. Indications. It is a powerful point to restore calm and vitality to the mind and spirit, depression, claustrophobia, agoraphobia, or forgetfulness. The window of the sky point, first aid, carbon monoxide poisoning. So consider for medical confusion, severe depression, claustrophobia, agoraphobia, or forgetfulness. As a window, it can lift and revitalize the spirit of a person cut off or imprisoned within themselves, often as a result of their reaction to chronic grief or sadness, commonly used with Li 17 or Li 18. Thank you for your attention.
Differential diagnosis, Western and Chinese medicine for menopausal syndrome. The menopause is the transition in a woman's life when the ovaries stop producing eggs. The body produces less estrogen and progesterone, and menstruation becomes less frequent, eventually stopping altogether. Signs and symptoms: hot flashes and night sweats, mood swings, irritability, depression and anxiety, poor memory, irregular menstruation with increased or decreased flow until menopause is completed, insomnia, vaginal dryness, and painful sexual intercourse, decreased sex drive, increased incidence of vaginal infections, increased micturition and incidence of UTI, bone joint and muscle pain. Causes: a natural event which normally occurs between the ages of 45 and 55. Diagnosis: blood and urine tests measure hormone levels, estradiol, FSH, and LH, which can indicate whether a woman is perimenopausal or postmenopausal. Possible complications: bone loss and eventual Osteoporosis, greater risk of heart disease, postmenopausal bleeding. Chinese differentiation. Diagnostic questioning according to organ interrelationships, the Shang and co-cycle relationships between water, wood, and fire, Shaoyin or Zhuyin. TCM picture, gradual weakening of kidney qi, deficiency of the Chong and Ren vessels, insufficiency of qi and blood. Kidney yin versus kidney yang deficiency. Deficiency of kidney yin fails to harmonize the heart life, leading to disequilibrium between the heart and kidneys, Shaoyin, and the development of anti-heat. Kidney yin deficiency can affect the liver. They share the same source of yi sheng cycle relationship, which can lead to liver yin deficiency, hyperactivity of liver yang generating wind. Kidney yin and kidney yang can both be deficient. Etiology, long-term stagnation of liver qi, gradual weakening of kidney qi, emotional strain, worry, anxiety, fear, poor diet, irregular eating habits, depletion of kidney yin from illness, blood loss, multiple pregnancies, excessive mental and physical work. Zhangfu patterns, excess, we have liver blood stasis, stagnation of liver qi, accumulation of phlegm and qi stagnation, hyperactive liver yang generating wind. Deficiency, kidney yang deficiency, heart and kidneys not harmonized, kidney yin deficiency with anti-heat, kidney yin and yang deficiency, liver kidney yin deficiency, heart blood and spleen qi deficiency. Thank you for your attention.
Let's continue our discussion on the patterns of qi movement and genuine qi. Patterns of qi movement. Qi can move in many ways, but these ways can be grouped in 4 basic patterns: ascending, descending, exiting, and entering. The Zhangfu viscera, the meridians, the tissues, and other organs are all places for qi movement. And qi movement is basic to the body's vital activities. Once qi moving stops, the life comes to an end. Qi is the motive force that propels and stimulates many vital activities of the body, but its actions can be seen concretely only in the activities of the organs, tissues, and meridians. For example, the lungs' respiratory exhalation reflects Qi's exiting and inhalation its entering. The lungs' dispersion action reflects Qi ascending and depuration descending. The spleen and stomach are in charge of digestion. The spleen raises the clear, so it is healthy when its actions are ascending. The stomach lowers the turbid, so it is harmonious when its actions is descending. The coordination and equilibrium between these 4 basic types of movements is called the harmony of the qi mechanism. When this harmony of qi is disturbed, the situation becomes one of disharmony of the qi mechanism. There are many types of disharmony of the qi mechanism. For example, failure of the lung in the dispersion, depuration, and descending may lead to sinking of the spleen, adverse ascent of stomach qi, stagnation of liver qi, or disharmony between the heart and the kidney. Fifth, the classification and distribution of qi. Owing to the complexity of qi in the human body, there are a variety of classifications of qi in Chinese medicine. For example, it can be classified by source, innate qi and acquired qi. It can be classified by location, qi of the Zhangfu viscera and qi of the meridians. Of Zhangfu qi, there are heart qi, lung qi, stomach qi, spleen qi, liver qi, kidney qi, and so on. In this section, 4 kinds of qi are discussed, namely genuine qi, thoracic qi, nutritive qi, and defensive qi. Let's talk about genuine qi. Genuine qi is called original qi or primordial qi. It is the most fundamental and important qi of the human body and primary motive force of the vital activities. Let's talk about its formation and distribution. Genuine qi originates from the kidney through transformation of the kidney's innate essence. It also depends upon acquired essence from drink and food for supplemental nourishment. Following formation, it flows throughout the body via sanjiao in the interior of the Zhangfu viscera and in the exterior to the muscles and skin. It has actions in all parts of the body. Second, its physiological actions. The principal actions of genuine qi are to promote growth and development of the body and to warm and stimulate the physiological activities of the viscera, the meridians, the tissues, and the organs. If genuine qi is ample, then the zanctal viscera, the meridians, and the organs are vigorous in their activities, and the body has a strong constitution and is relatively free of disease. If genuine qi is deficient because of insufficient innate endowment, inadequate postnatal acquisition, or damaged by prolonged illness, many illnesses may ensue. Thank you for your attention.
Diagnosis according to Zhang organ patterns, kidney yin deficiency, and kidney yang deficiency. There can be combined patterns that do not just manifest simultaneously, but in fact have become a joint pattern. This is particularly relevant with regards to kidney imbalances, as kidney yin and kidney yang are the foundation of yin and yang in the whole body. When kidney yin and kidney yang are out of balance, the imbalance will usually encompass other organs. When there is a chronic imbalance in another organ, it will often end up affecting the kidneys. Unlike other organs, the kidneys do not have any excess patterns of imbalance and quite easily be yin deficiency and yang deficiency concurrently. Kidney yin deficiency and kidney yang deficiency often arise as a consequence of each other because they are mutually dependent and in reality are just aspects of each other. This means that when one aspect is deficient, the other aspect will also become deficient over time. One of the aspects, however, will always be more deficient than the other. This aspect will therefore be the primary focus of the treatment, but the other aspect will also be treated at the same time. The patient will manifest with a combination of both kidney yin deficiency and kidney yang deficiency symptoms and signs. The tongue and pulse will be crucial factors that determine which imbalance is the most dominant. The treatment of kidney yin deficiency and kidney yang deficiency with needles is relatively straightforward, as the points used are generally the same, but the major difference is the use of moxa when there is kidney yang deficiency. When employing herbs or pre-prepared pills, the situation is slightly more complex. It is important to determine which aspect is to be the primary focus of the treatment. One approach that can be utilized when treating with pre-prepared pills is to prescribe more of one type of pills than the other. For example, if kidney yin deficiency is more pronounced than kidney yang deficiency, the patient could be prescribed 6 Liu Wei Ti Huang pills and 2 Qing Hui Shan Qi pills 3 times a day. Another approach is to administer the pills to treat kidney yang deficiency in the morning and the pills to treat kidney yin deficiency in the evening. It is, of course, possible to combine both these two approaches. So in summary, we have the kidney yang and kidney yin deficiency, predominance of kidney yang deficiency. The etiology is emotional strain, fear, shock, anxiety, excessive sexual activity, chronic illness, old age, overwork, childbirth. Underlying or accompanying pathology, kidney qi deficiency, kidney essence deficiency, liver yin or blood deficiency, spleen qi deficiency. Signs and symptoms, lower backache, cold knees, sensation of cold in the back, feeling cold in general, feeling of heat in the face, menopausal hot flashes, night sweating, weak legs, bright white complexion, weak knees, impotence, premature ejaculation, low sperm count, thin sperm, decreased libido, tiredness, lassitude, abundant clear or scanty clear urination, urination at night, apathy, edema of the legs, infertility in women, loose stools, depression, pulse, deep and weak, tongue, pale. Treatment principle, supplement the kidneys, fortify the yang. Acupuncture treatment, bladder 23 to supplement the kidneys, REN 4 to supplement kidney yin or essence, REN 6 to foster original qi, fortify yang, bladder 52 to supplement the kidneys and essence, extra point qigong, supplement the kidney yang. Do 4 supplements the kidney yang, kidney 3 to supplement the kidney yin or essence, kidney 7 to supplement the kidney yang. Needle with supplementation. For kidney yang and kidney yin deficiency, predominance of kidney yin deficiency. Etiology, emotional strain, fear, shock, anxiety, excessive sexual activity, chronic illness, old age, overwork, childbirth. Underlying accompanying pathology, kidney qi deficiency, kidney essence deficiency, liver yin or blood deficiency, spleen qi deficiency. Signs and symptoms, dizziness, tinnitus, vertigo, poor memory, difficulty hearing, night sweating, dry mouth and throat at night, lower back ache, ache in the bones, nocturnal emissions, infertility, premature ejaculation, tiredness, lassitude, depression, slight anxiety, cold feet, abundant pale urine. Pulse floating and empty or weak on both rear positions. Tongue, normal color and peeled. Treatment principles, supplement the kidneys and essence, nourish kidney yin. Acupuncture treatment, Ren 4 to supplement kidney yin essence, kidney 6 to supplement kidney yin, kidney 9 to regulate qi and alleviate pain, Ren 7 to benefit the lower burner and genitals, lung 7 with kidney 6 to open the Ren vessel, the sea of yin. Kidney 3 to supplement the kidney yin and essence, kidney 10 benefits the kidneys, spleen 6 to supplement the yin, needle with supplementation. Thank you for your attention.
Let's continue a discussion on imbalance of the depletion of yang or yin. This is a very serious condition in which yin fluid and qi is abruptly depleted, leading to loss of their action and consequent cessation of organic functions. There are two types, yang depletion and yin depletion. Let's talk about yang depletion. This is a serious condition in which yang qi is suddenly lost, leading to severe failure of all functions of the body. In general, this arises mostly when evil qi is so powerful that genuine qi is rooted in their struggle and collapses. Another cause is excessive fatigue and exhaustion occurring in a person already deficient in yang qi. The condition can also arise when patients are incorrectly treated with excessive use of diaphoresis. Yang qi escapes the body along with the inappropriately profuse sweating, leading to sudden collapse of yang qi. Finally, it may also appear in an advanced stage of chronic disease when deficient yang floats and dissipates due to severe consumption of yang qi. Since yang qi and yin fluid have a mutual relationship, depletion of yang can lead to failure to produce yin fluid, which therefore also becomes exhausted. Depletion of yang is thus usually followed by the exhaustion of yin. Under such circumstances, once yin becomes severed from yang, life comes to an end. Now let's talk about yin depletion. This is a pathological state in which severe consumption or sudden loss of yin fluid leads to serious decline of systematic function in the entire body. The most common cause is strong heat evil or chronic heat evil in the body. In both cases, there is large-scale scorching of yin fluid. Another cause is massive hemorrhage, vomiting, or diarrhea, or other disorders that rapidly consume yin fluid. Yin depletion is also a very serious condition. At the time of yin depletion, there often are such symptoms of yin fluid collapse as labored breathing, agitation, warm hands and feet with greasy sweat, delirium, or coma. Thank you for your attention.
Enuresis and incontinence with liver fire infusing downwards as a pattern. Clinical manifestations, nocturnal enuresis in children, grinding teeth at night, restless sleep, nightmares, waking up crying, thirst, bitter taste, hypochondrial pain. Tongue is red with redder sides, yellow coating. Pulse, wiry and rapid. Enuresis in children can be classified in two broad categories. On the one hand, quiet and shy children. On the other, rather hyperactive and nervous children. The pattern of kidney deficiency pertains to the former group, while that of liver fire pertains to the latter group. Nocturnal enuresis in such children is also due to agitation of the ethereal soul, or hun, at night by liver fire. Treatment principles: soothe the liver, drain fire, calm the mind, and settle the ethereal soul. Points: liver 2, heart 7, yin tang, spleen 6, bladder 28. Reducing method on all points except bladder 28, which should be reinforced. Liver 2 drains liver fire. Heart 7 and yin tang calm the mind. Spleen 6 regulates the water passages and calms the mind. Bladder 28 strengthens the bladder function. Case history. An 11-year-old boy had been suffering from nocturnal enuresis from birth. He never had a dry night. He appeared to be a very tense child with a nervous tick of his eyes. His tongue was red with redder sides and tip and red points on the sides and tip and a yellow coating. His pulse was full and wiry. This boy's condition is very clearly liver fire. This is very often seen in tense and nervous children. The principle adopted was to drain liver fire, absorb leakages, calm the mind, and settle the ethereal soul. He was treated with acupuncture and two patent remedies. The acupuncture points used with reducing method were selected from the following: liver 2 to drain liver fire and settle the ethereal soul, heart 7 to calm the mind, spleen 6 to pacify the liver. Case history. Another case history is of a 10-year-old girl had been suffering from nocturnal enuresis since birth. She did not wet the bed every day like the boy in the previous case history, but about twice a week. When she was 5, she had had a bout of cystitis with burning on urination. She was a shy and quiet child with a pale complexion and a bluish tinge on her forehead. Her tongue was pale but with red points along the left side and on the root. Her pulse was very slightly wiry on the left side and otherwise normal. This child manifests symptoms from both full and empty types of patterns causing enuresis. There is a kidney deficiency manifesting with a pale tongue. This deficiency was probably due to fright, which may even have occurred in utero, as the bluish tinge on her forehead shows. Besides this, there is some liver fire and damp heat in the bladder, manifesting with the red points along the left side and on the root and the wiry pulse on the left. The cystitis episode she had when she was 5 would seem to confirm this. The principle adopted was to tonify the kidneys, absorb leakages, calm the mind, settle the ethereal soul, and pacify the liver. She was treated with acupuncture and patent remedies. The acupuncture points used with even method to pacify the liver and reinforcing method to tonify the kidneys were selected from the following: heart 7 to calm the mind, liver 2 to clear liver fire and settle the ethereal soul, spleen 6, kidney 3, ren 4, and bladder 23 to tonify the kidneys. Thank you very much for your attention.